in terms of what we understand, actually it might be better if you go first, and just in terms of positioning this National Disability Insurance Scheme, so where it fits and where it's up to at the moment.
Okay, thanks, Valma. The National Disability Insurance Scheme is not a new concept. There's a story to the National Disability Insurance Scheme, and it began, such a scheme was promoted and discussed and about to enter Parliament on, it was placed in the Senate hearing for the 12th of the 11th of 1975. And is that date significant? What happened on the 11th of the 11th of 1975? Whitlam got dismissed. It's the biggest public policy scope since Medibank was introduced in 1974 legislation. The story behind why the NDIS, well, it wasn't an NDIS, and it was going to be a hypothecated tax such as Medibank, is that Whitlam went to one of the, what preceded college meetings with all the premiers, and he had driven strongly for a New Zealand version of a disability insurance scheme. They'd all agreed to it. He went to the toilet in a break. Bill Hayden, who was the treasurer at the time, also went to the toilet and said, we've got to get Medibank up first. And so Whitlam come in after the toilet break, and Medibank got up, and the rest is history. In 1994, well, the Women's Electoral Lobby in Queensland, and I, as part of the Disability Advisory Council, was talking with Carmen Lawrence about having a disability and ageing tax for such a thing as the NDIS. So this story is the third grab. And as you can see, if we don't get it this time, it'll be another 15 or 20 years before there'll be another opportunity. So the importance of us who can see the inherent benefits, the eradication of a broken system, the eradication of band-aid responses such as respite, such as temporary supports, inadequate supports, institutional living arrangements, forced co-tenancy, all of those abhorrent and, I would argue, discriminatory and now under international law illegal practices will be eliminated in the due course of time. We will see for the first time people with disabilities who have significant support needs will be treated as subjects with rights, not as objects of pity and charity on the misery lottery stakes. We'll see the elimination of such campaigns as Younger Purple in nursing homes, such campaigns for parents and family members to give up their identity as a parent or a family member or a lover or a brother or a sister or a husband or a wife, to take on the role as a carer with all the obligations of a paid carer and none of the benefits. And we will not see a range of other sort of policy directions that tears the relationships apart in families, in your local communities, in schools, and so on. So this NDIS, this time and moment in time, we all have an opportunity to not only witness history being created, but to be part of creating history. And Blue Skies offers us that opportunity. But the greatest challenge, yes, there will be sectors within the disability sector, there'll be minority groups within service providers, families and people with disabilities who will be very fearful of losing what they think they have now. But it is not those people who are going to change or alter this direction. It is going to be the people who don't have people with disabilities in their lives. And the challenge for us is to not preach to the converted, but the converted, the unknown. The next person out there who's going to be the next champion for the NDIS is when we can stand aligned strongly with a powerful voice from ordinary members of the community, with people with disabilities, their families, their local communities. Then we will get true cultural reform in the form of legislation, policies and practice. So I'm really encouraged by who you are and why you're here today. And I want to just share those sorts of words and thoughts with you, because one of the reasons Blue Skies evolved was that, you know, it took us a little while to realise that governments were not going to hold visions that built a society, a civil society, that respected and protected and fulfilled vulnerable people's human rights. They would only do it when they thought they had popular support for it. And it is no use us blaming governments for not doing stuff, because it is our responsibility to make sure there is broad-ranging support for an inclusive community, not only for people with disabilities, but all vulnerable people in our society. So on that note, I think I'll hand back over to Velma.
Comments on what you've heard or seen from the report, the interim report so far?
Sorry, can I make another one?
Yeah.
Just about service providers, I'm really concerned that, you know, about the transition. So I think you touched on it. You know, no use giving us an entitlement to supports if the supports aren't there. So, and formal supports are part of that. So, supporting service providers to make the transformation that will be necessary to meet people's, you know, needs. So, and it's very light on there. You know, I can't sort of see anything in it about that. It's just basically suck it up and get on with it, and the market will decide. And, you know, I mean, I have a bit of a problem with the market deciding, and not to protect service providers, but to, you know, to ensure that they're still there, and to ensure that there's diversity across the sector, from the small, you know, and really grassroots local organisations to the big, you know, sort of corporate kind of models. So it just seems there's nothing in there about that. And what's the use of giving us funding if the service...
In some sense, it's about saying, working with service providers to reform.
Absolutely.
And if they're not going to reform, well then...
Yeah, bugger it off. Yeah, yep. That's right. Yeah, but in my sense is that service providers welcome it with open arms and are willing to do whatever it takes to transform to meet people's needs. I mean, that's why service providers are there in the first place. Sure, there's the minority, but, you know, help us do that.
And certainly our experience with service providers, because we're a service provider organisation, has been that there is a real recognition that there needs to be more creativity in what service responses need to look like. It will be an open marketplace, and there, as Jane said, there's no lack of willingness to sort of, okay, read the writing that's on the wall and say, how do we need to reconfigure, how do we need to redesign our services and redesign our jobs and our workforce to accommodate that. So I guess as a community, and Blue Skies is very much a mixed, motley bunch of people from different parts of the community, that we need to start to not say we're going to do some research and look at what overseas is doing, but actually put our heads together and start to get a bit more creative and let more creative solutions emerge from our conversations together that will shape the system. So don't wait and see what comes down to us as options, but actually start to think about, well, if this were to work as it possibly could without the constraints that we know now, what could that look like? How do we make sure we don't just end up with half a dozen big services who basically broker everything, or state government who is left with no other role other than regulation and ends up being the major broker? Now, and maybe those options would be okay, but in all likelihood we will want a richer range of choices than that. So what we might do then is just take 5 or 10 minutes to have a chat at your table groups, and I would ask that you not be bound by the constraints of our current system, because this is the first chance we've had in a very long time to actually think that some of the constraints we understand within our system now may not be there, this time in 10 years' time. So for this exercise, for this discussion at your table, think if the constraints we currently know were not there, what would be possible, and what at a fairly ground level could the system look like in a way that would truly provide a rich range of quality choices in terms of getting the supports that people need. We're not assuming that the traditional service types, or what we understand as service types or service models now, in fact we're wanting to completely get rid of that language and think in terms of what responses from services would need to be in place. How would we make sure that they are available just as comprehensively regionally as they are in metropolitan centres? What could that look like?
Service providers like staffing options who mainly did recruiting and training and outsourcing, because I look at what I'm able to do with the CLO money, I'm paying people more than what they get working for a service, but it's costing me $10 an hour less than what the service is charging me for my daughter's post-school. $35 an hour for one-to-one support for post-school, and I'm paying $26.50 for after-hours support on a Friday night. And I just go, what? And then also whacking off 20% from the funding to administer the funds, and I'm going, And then you look at the smaller personalised services that are around, like Homes West and Kalpana and others, and they charge so much less, and they do have person-centred responses. So I can feel that potentially the NDIS is going to allow people to go and do what they want when they want. But it does mean that service providers and their staff are going to have to be, a whole different culture about how they approach this. It'll be more like, well, what would you like us to do? Not, this is what we offer.
People should be being empowered to
find a way to get their community to empathise with people with disability and their families, the way they empathise with the people who suffered after the floods.
So that if you have a particular disability, you don't feel like you're always on the asking end of things, because there are those who can take the initiative and know what your needs might be.
And even the government response in terms of $1,000 if you've been inconvenienced. Every 12 months, in the Labor government anyway, if you're a carer, you get $1,000 for the year, But if you didn't have your power on for 4 hours or something, and were inconvenienced or very minor, you get $1,000 through the flood.
Another thing I was thinking about was when we first started the day service that we had, our idea was that our guys had not finished their education, had severe to profound intellectual disabilities, and they had only just begun, and they were suddenly cut off. And our idea was to continue, sort of literacy and numeracy training and all of that sort of stuff. But we can't do that. We can't afford the assessments, we can't afford the teachers, we can't afford it. Now, they're saying that that is going to be the responsibility of education. I would argue that actually that's going to be the funding responsibility of an NDIS.
No, someone should speak.
Thanks, Kerry.
Yes, Jane was saying that she'd like to see a greater number of specialists available in therapies, etc., and a cutting of waiting times, and that's specifically from Muswell District of Queensland, and asking about services that really are what people need.
Now, before you move on, Okay, so you want access to therapists. What does that look like?
No, that conversation was about like if it's going to mean that people can identify their needs and then go where they want. Well, we already have a problem in the community about people's wait time with accessing therapists or specialists or that. So that also needs to be thought about, as in, you know, the education and the qualification to get more pools of those people there, so that there's more people to be accessed. Does that make sense?
Yeah, and is it special is there a special kind of therapy you're talking about?
Well, I'm just generalising. I guess from my perspective, people talk about accessing. It can be 3 or 4 months waiting list for to see a physio in community health, or something called, you know, neurologist will maybe every couple of years, or, you know, that kind of thing.
Is that in the public system?
Yeah.
What about the private system?
Well, people I've spoken to, who are in private health are accessing specialists a lot better.
So you could use the money that privately accessed could improve.
For sure, but then I was wondering if a lot more people then have that money to access, does that mean there's a lot more demand, so we still, it's just something to think about.
There's still some skill development within that, you know, for say kids with cerebral palsy, families finding physio privately, great, but to actually have the skills to support their child, very difficult.
That's true, yeah, that's right. Understanding
that's
the condition.
education.
Yeah, skill.
Yeah.
But just go back to, you're talking about the need for evidence. So if there's no support of something that the literature isn't supporting, what can be in place? Because this goes back to the quality, because it's one thing to have purchasing power, but it's got to be decent things that you've got access to that will actually make a difference.
You
so
don't want quacks.
And you don't have to rely on what's happening overseas. What would we have in place here that maintains some sort of rigour or oversight of what people do have access to? Or should it be just pure market?
At the moment, private medical cover will actually cover a number of alternative therapies, such as massage, naturopathy, acupuncture, that kind of thing. So given that would set a form of precedent for those semi-non-traditional therapies, that could be one indicator, not saying it's the only one, but it could
That's
be
a great,
one.
great.
That's a good point, Fran. Because I know a woman who's a successful consultant now, has mental illness, and when she goes into an episode, her husband and her go and book themselves into a holiday unit up the beach, walk up and down the beach for 3 or 4 days, and she's through the episode and back home. And Medibank or whoever she's with pays for the accommodation because it's much better than a 3-month stay in a private mental health hospital. So it does probably provide with a framework of argument to, and they're the private for-profit sector.
Yeah.
I guess, our job here is to think about, now, what are the unintended consequences here? We can see the broad framework they've offered here, but what could go wrong here? And they're asking for the bits that are light on in the report to be fleshed out a bit. So we're wanting to think and give them really clear, detailed feedback about what they need to make sure they build into this new system so that it doesn't go to that ridiculous sort of stuff we see now.